Welcome to this Medmastery coronavirus update. I'm Franz Wiesbauer. I'm an internist trained in epidemiology and public health at Johns Hopkins and the founder of Medmastery, where we teach important clinical skills to doctors and other healthcare providers around the world. Let's start today's update with a message from the president.
The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
I guess I'll leave this uncommented. We actually get the question all the time. Will the coronavirus go away in the summer like influenza does? Well, let's look at the facts. Let's look at this paper published by James Tamarius and coworkers on global influenza seasonality. So first of all, influenza is clearly seasonal. That's a fact. The incidence is clearly higher in winter, which would be December through April for the northern hemisphere and June through September in the southern hemisphere. Interestingly, in the tropics, the incidence appears to be greatest during the rainy season, which you can see here for Singapore and Brazil. Now the question is, can we expect that same pattern of seasonality for the coronavirus? Some people say, well, the common cold coronaviruses are also seasonal with little transmission in the summer, so SARS-CoV-2 will also behave like that. The problem with this statement is that these people, and President Trump is one of them, forget the fact that new viruses that we've never been exposed to behave very differently from existing viruses where there is pre-existing immunity. Once SARS-CoV-2 has infected a large proportion of the population, extending the statement of seasonality of common cold coronaviruses to SARS-CoV-2 might very well be valid. Let's look at the reasons why influenza is seasonal, and let's see if we can transfer some of that knowledge to COVID-19. There are three main reasons or factors for seasonality of influenza as far as we know right now. Factor number one is the environment. Factor number two is human behavior. And factor number three is the depletion of susceptible hosts. Let's take a closer look at each one of them. Let's turn to reason number one, the external environment. Here's a really interesting study by Lowen and Steele published in the Journal of Virology. They showed in the lab that absolute and to some extent also relative humidity as well as temperature strongly affect flu transmission in guinea pigs. Humidity is shown on the x-axis and transmission efficiency is shown on the y-axis. The experiments were done at various temperatures, 5 degrees Celsius, 20 degrees Celsius, and 30 degrees Celsius. Transmission clearly went down as temperature increased from 5 degrees to 30 degrees and as absolute humidity increased. Now, this is in animals. Does that also apply to humans? Shaman and colleagues answered that question in a paper published in PLOS Biology. They say that a recent reanalysis of laboratory experiments indicates that absolute humidity strongly modulates the airborne survival and transmission of the influenza virus. That's the study we've just seen. They continue, here we extend these findings to the human population level, showing that the onset of increased wintertime influenza-related mortality in the United States is associated with anomalously low absolute humidity levels during the prior weeks. Then they continue, these findings provide epidemiological support for the hypotheses that absolute humidity drives seasonal variations of influenza transmission in temperate regions, meaning non-tropical regions. Now, does humidity and temperature also influence the transmission of SARS-CoV-2? Well, let's look at this analysis from Harvard University scientists. These authors looked at how absolute humidity affects the reproductive number, the average number of individuals infected by one infectious person. They found that the reproductive number was pretty stable irrespective of humidity. Two caveats here. The reproductive number in other papers has generally been described to lie somewhere between 2 and 3. So what we see down here seems a bit low. Secondly, Yiling and Heilongjiang up here are rather cold and dry provinces, and here the reproductive number seems to be rather high. But overall, their conclusions were, our results suggest that changes in weather alone, i.e. increase of temperature and humidity as spring and summer months arrive in the North Hemisphere, will not necessarily lead to declines in case counts without the implementation of extensive public health interventions. There you have it. Let's turn to factor number 2, why influenza is seasonal: human behavior. In winter, humans spend more time indoors with less ventilation. They're closer together as opposed to summer when they're outdoors. Schools play an especially important role here. A lot of influenza transmission is going on inside schools and daycare. Huang and coworkers published a nice paper in the Journal of Epidemiology on the 2009 H1N1 pandemic, quantifying the impact of school openings on the reproductive number. You see here on the x-axis the weeks before and after the opening of schools, with 0 being the actual opening for various US states. The incidence is depicted on the y-axis. And I hope you can appreciate that school openings clearly have an impact on influenza transmission. So would this phenomenon also apply to COVID-19? As we've seen in a previous video, reported infection only rarely occurs in school kids. Just 2% of infected cases occurred in kids and teenagers under 20. So we just don't know if kids don't get infected or if they do get infected and just don't develop severe symptoms. If they do get infected, they might play a role in transmitting the disease. If they don't get infected, then schools and daycare centers would not be places where significant transmission occurs. This is an area where we are in desperate need for more information. Right now, we have no idea if closing down schools would significantly hinder transmission. Let's turn to factor number 3, the depletion of hosts. Let's recap real quick. As we've learned in the videos on R0, the serial interval, and herd immunity, this is what happens when you introduce an infectious individual into a population of susceptible individuals. They'll spread the disease, and these newly infected will spread the disease in turn. At some point, the infection will have burned out because it infected so many individuals that herd immunity is reached, and the effective reproductive number will become equal to or lower than 1. As we've seen previously, when the reproductive number is greater than 1, like at the beginning of an epidemic, the number of infected individuals would go up. When it's equal to 1, the number of infected stays constant, and when it's lower than 1, the number of infected will go down. Well, as these authors showed, that's exactly what happens during the influenza season. These influenza viruses, most of them, are not entirely new to the population. Many of them have been around in previous seasons. So the reproductive number or infectiousness is high during winter months, October through April. Then when enough people have been infected, R will go down. So the bug becomes less infective. And with the humidity increasing and the temperature going up and kids not going to school, the virus seems to disappear again in summer. But it's still there. It's just waiting for more susceptible individuals to be added to the population in order for R to go up again. And one more thing. Some people have claimed that the seasonality of influenza could be due to lower vitamin D levels in the winter. This model simulation of seasonal influenza from Harvard, using data from the health professionals follow-up study, showed that it is unlikely that seasonal variations in vitamin D levels principally determine the seasonality of influenza in temperate regions. Just for completeness sake, I wanted to mention that. So like in a previous video, I'd like to acknowledge Mark Lipsitch from Harvard, who has co-authored most of the studies cited here. As he put it, even seasonal infections can happen out of season when they're new. New viruses have a temporary but important advantage. Few or no individuals in the population are immune to them. Old viruses, which have been in the population for longer, operate on a thinner margin. Most individuals are immune, and they have to make do with transmitting among the few who aren't. So it's likely that we're going to see further spread of SARS-CoV-2 in the summer. Maybe some attenuation due to warmer weather or school closings, but that's totally hypothetical, and we should not count on it. That's it for now. If you want to improve your understanding of epidemiology, make sure to register for a free Medmastery trial account and attend our Epidemiology Essentials course. We've just opened it up to trial users due to the huge demand. So stay safe and talk soon.